Hi, my name is Madison and I'm going to be doing a demonstration on how to insert a Foley catheter into a male. So before I walk into my patient's room, I'm going to check the chart, check the physician's orders to make sure that I am doing the correct procedure on the right patient and to make sure that I have the correct size for my patient. So when I walk in, I'm going to provide privacy. I'm going to wash my hands. And after I wash my hands, I'm going to introduce myself to my patient. Hello, my name is Nadia. I'm going to be your nurse today. How are you? Do you have any pain right now? Can you tell me your name and date of birth, please? And then once I do that, I'm going to explain the procedure to the patient so that they have a clear understanding of what's about to happen and what's going on. If they have any questions, I will do to my best ability to answer the questions that they have. So before I start the procedure, I'm going to prep my patient. Because I am not in a hospital setting, my table is on the floor, so I'm going to get on my knees so that I am at waist level with my patient, so I'm not hunched over causing back pain during a sterile procedure. And then I'm going to make sure the side that I'm standing on, that the rails are down, and on the opposite side that they're up if they're not already up. Then I'm going to lay my patient back into a comfortable position. Once I do that, I'm going to expose the penis area, and when I expose the penis area, I'm going to make sure that the upper half of the body and lower half of the body is covered with a blanket or pillow. And then once leaving the penis area uncovered, once I do that, I'm going to grab gloves. When I grab gloves, I'm going to push on the distended bladder, ask my patient if there's any pain or tenderness when I push on the distended bladder. And then once I do that, I can now use warm water and soap to clean my patient's penis. And then once I do that, I can dispose those gloves and I can begin my procedure. So once I start my procedure, I'm going to take out my kit, making it into a garbage bag to dispose anything that I don't need or anything that I use. I'm going to set that right here. Alright, once I do that, I am going to open my kit, not reaching over, being mindful that there's a 1-inch border. Just gonna kind of spread this so I'm not reaching over. All right, perfect. So this is my 1-inch border around here. And then before I do anything now, I'm going to put on my sterile gloves. All right, so I'm going to grab under. Sliding my glove on. Leaving it. I'm going to use this hand. I'm going to grab under the cuff, not using my thumb, and I'm going to slide my hand in. Leave it just like that. Once I do that, I'm now going to grab this drape, keeping in mind this is a 1-inch border. All right. Put in shiny side down. Alright, so that this is draped underneath my perineum. I'm now going to grab my drape. And I am going to carefully drape the penis. Alright. Once I do that, I can now gather my supplies. I'm going to make sure this box does not exceed over my 1-inch border. Making sure that this plastic doesn't exceed my 1-inch border either. Alright, I'm going to open my cotton swab sticks, go around the field, place into the garbage bag. Take out my swab sticks, place them here. In the garbage bag. This is iodine. Because I have my alcohol swab sticks, I do not need this. Paste that there. If I did use my iodine, I would soak the cotton swabs in it, and then I would use a picker to wash around. But I have swab sticks, so alcohol swab sticks, so I don't need to worry about that. Now I can use my lubrication. Set it back in there. Take the cap. in my saline. Take off the cap. All right. Now I can grab my catheter. And I'm going to set this, moving this over, set this on my sterile field. All right. To remove the plastic, go around, toss that into the garbage bag. I'm going to use my saline to connect it to my catheter. All right. Then I have my lube. And this is the lubrication that I'm going to insert into the urethromeatus before I start. If this were a female, I would push this into the tray, and then I would dip the catheter in the lubrication before I insert it into the the vagina. But since I have a male, I'm just going to insert it into the urethromeatus when that time comes. Before I start, I'm going to keep in mind that whenever when I put my hand on the penis, that it is going to not be sterile anymore, so I have to leave it where it is, and I cannot come back into the sterile area to do anything. All right, so now, if my patient were circumcised, if my patient was non-circumcised, I would pull down the foreskin and I would clean around the penis that way. But since my patient is, I can just grab the head of the penis and I'm going to clean around it, go around, toss, clean around the urethromeatus. Toss. All right, so my hand is not sterile anymore. I'm going to keep it right here. And then I am going to let my patient know that I am inserting the lube into the urethromeatus. So this is where I would insert it. Then I'm going to go out, discard that. And then I'm going to let my patient know that if it might be uncomfortable, you might feel a little pressure, it might be a little painful, but if it becomes too much, just let me know. And I'm gonna have them take a big, deep breath in. And I'm going to now insert my catheter. And then when I have them take a deep breath, I'm gonna count to 3. And then when I do 3, that's when I'm going to insert it. So 1, 2, 3. All right. And I'm going to go down about 1 to 2 inches. Go down to about 7 to 9 until I see urinary retention. And once I see urinary retention, I can insert, making sure that this catheter does not touch this hand. That's not sterile anymore. I can now insert my saline. And a bubble is going to form. And then typically, if this were a real scenario, I wouldn't be able to see the bubble forming. So I would just know. And then I would go around, toss that into the garbage. And to know that I have the catheter in the right spot, I'm gonna pull back on it. And once I see that it's retracting to come out, I know that my catheter is in the right spot. So I'm gonna make sure that my patient, that he's not feeling no type of discomfort, or if it's fine, like if he's not feeling too much pain. And then once I do that, I'm gonna make sure that this part is taped to my patient's leg. And then also I'm going to make sure that there's enough space between the catheter and the patient so that it's not pulling the catheter out to where it's uncomfortable or to where it's just not comfortable at all. And then I'm also going to make sure that this bag is at bedside so that when the nurses come in, they can get a correct reading of what the patient's urinary output is. And then I'm also going to make sure that I have the bag clamped so that when the patient does urinate, it doesn't make a mess and spill out anywhere. And then I'm going to rip the drape. This drape right here would be ripped in half, and I would pull it. I wouldn't pull it over the penis. I would just slide it out from underneath. So and then when I rip it in half, it would be like that. And then once I rip that up, I can gather my supplies. Before I leave, I'm going to make sure that my patient is positioned upright so that he's comfortable. And then make sure that the call light's on the bed. I'm going to ask him if he needs anything, and then I'm just going to gather my materials. And I think I hit everything.